Hi, Miss Tyson. How are you?
Fine, how are you?
I'm good. So my name is Charity. I'll be your student physical therapist. So I'm going to go ahead and wash my hands before we start. And this treatment is going to require me to touch you. So is it okay if I touch you?
Yes.
Okay, so I was reading your chart. I understand that you're having some upper extremity lymphedema, which is lymphedema in your arm. So today we're going to do some compression wrapping, and that's basically just going to reverse the direction of the lymph towards your heart.
Okay.
And the whole goal of this is just to decrease the size of your arm, decrease some of the swelling that you're experiencing, and just to provide more support.
Okay.
All right, and so I'm going to check your sensation, which is your sense of touch. So I want you to close your eyes for me, please. And if you feel me touching you, say yes.
Yes. Yes. Yes. Yes. Yes.
Okay, you can open your eyes. And I'm just going to look at the skin integrity, just make sure I don't see any excessive redness or bruising. And everything looks good. All right, so I'm going to ask you a few more questions. You can open your eyes. I'm just going to ask you a few more questions. So do you have any history of heart failure?
No.
Do you have a DVT?
No.
Do you have an acute fracture or acute infection?
No.
No? Okay. All right, so like I said, just the whole purpose of this is just to reverse the direction of the lymph. So we're going to go ahead and get started. Do you have any questions for me?
No.
Are you comfortable?
Mm-hmm.
Okay. All right, Ms. Tyson, so we're going to go ahead and start your treatment. So I'm going to apply this stockinette onto your arm. So pretty much this is just going to protect your skin. So slide your hand through. All right, I'm going to take this off. All right, so this is the finger gauze, and it's just the same thing. It just helps protect your skin and just to help protect your skin from getting any infections. And just go ahead and relax your fingers for me, please, and relax your hand. Does this feel okay?
Mm-hmm.
Okay, and just open and close your fist for me, please. Let's go and check over. All right, so next we're going to do the phone. So stand up, and you can form a fist for me, please, and punch into my stomach. All right, that feel okay?
Mm-hmm.
Okay, so you can relax your arm down. And next we're going to apply the actual compression bandages. And this is just going to also encourage the lymph to return back to your heart. And you can open your hand for me. And now you can punch into my stomach. Is this feeling okay?
Mm-hmm.
Is it too tight?
No.
Okay. Okay, can you bend your elbow for me, please? Does it feel okay?
Mm-hmm.
Alright, so I want you to open and close your fist for me, please. Alright, so we are all done, Miss Tyson. As far as skincare goes, I want you to make sure that you use hypoallergenic lotion. That's just because your skin will be a little bit more dry, so I want you to use that daily. I also want you to avoid doing any scrubbing to that arm during bathing. I also want you to, if you feel like you're going to be traveling and you're going to be on an airplane, I want you to make sure you use your compression bandages, especially while traveling. I want you to also avoid any applying any hot packs or any hot showers or getting into a jacuzzi. Try to avoid that, and try to avoid lifting anything that's really super heavy. And as far as the bandages go, just try to switch them out every 6 months, just because the elasticity kind of gets lost over the months, and to have 2 pairs. Just if you're washing one, you can still wear the other. Do you have any questions?
No.
Okay, well, we're all done.
Thank you.
Mm-hmm.